For spreading out your slides, this is critically important to make sure that we get a diagnostic sample. We want to spread them as gently as possible, but we have to spread enough that all the cells are not going to be piled on top of each other. So I prefer to use what we call the horizontal squash spreading technique, where we're going to very gently touch two slides together with minimal pressure, move the spreading slide from one end to the other, and trying to make sure that we have the sample that's going to end up in the middle of the slide. If it's really on the periphery edge, the pathologist might actually not be able to zoom down in onto that slide enough to see all the cells that you've collected. You want to try and avoid letting the slides vacuum or sort of stick together, you know, when you kind of put a drop of fluid on top and it almost feels like the slides have just sandwiched together. That is too much pressure. We risk sort of rupturing all of those cells, and especially for suspect lymphoma, if the slides get to the lab and every single one is crushed, even if we're highly suspicious that it's probably lymphoma, they will not be able to give you a diagnosis on that. So some do's and don'ts. Occasionally our labs will receive slides where no spreading has been done. So these kind of spray or splat slides, as we see here in image A, these are going to be completely non-diagnostic. All the cells are crowded on top of each other. You can't discern individual cell anatomy. So again, we sort of wasted our time with those. There's also this vertical squash technique, which we can see in image B. This is basically where we're just sandwiching the slides right on top of each other and not spreading. Here we can traumatize the cells, as well as risk having them stacked on top of each other. So image C on the right, that's what we want to do. This is that horizontal squash spreading technique where we've been able to spread the cells out gently into a uniform monolayer, and we can really see all of their individual details effectively. We want to try and get that sample spread onto the slides immediately right after you've collected the sample, because if there is a little blood in there, you can clot the sample in the needle hub and not actually be able to get any of those valuable cells out.